Respected audience, dear friends and viewers, hello and welcome all. It gives me great pride and privilege to connect with you on this digital platform and on this great health show. My name is Dr. Shah Imran and I work in Al Shams Medical and Diagnostic Center as a general physician. And today I take this opportunity to walk you through on one of the most important healthcare topics that we are facing during this pandemic. I'll also shed light on some of the important healthcare tips and also try to answer and give you my insight on one of the most common questions which are invariably asked in our clinical settings. My dear viewers, COVID-19 is known as a disease which has no boundaries. It has taken the world by a storm. Not only has it crossed the barriers of caste, creed, color and religion, it has also traversed the different communities, countries and continents together. But in the light of new data published by CDC and Johns Hopkins, it has exposed the vulnerability of the high-risk diabetic population, who are the main people who have had the brunt of and fury of this devastating disease, both in terms of having different life-threatening complications and having high mortality and morbidity risk. Thus, as physicians, it's imperative that we take extra care of our diabetic population through adopting different holistic procedures for their physical and mental well-being. My dear friends, since our diabetic population are well aware of the lurking danger, they usually don't go outside, they stay indoors, they stay in quarantine, they stay in self-isolation. But staying inside has a greater price to pay. It affects their physical and psychological and mental psyche. It causes a lot of apprehensions, anxieties, emotional and psychological breakdowns. And there are a lot of unanswered questions. That is the reason for today's episode. So today, let me tell them, please don't panic. We are with you in this together. We are just a call away. We are here to help you. So without wasting time, let me just jump on and start to the first question, which usually we get in our clinical practice. Are diabetics more prone to COVID-19 disease? I hate to answer it, but in the light of new data, it seems to be yes. Especially in the higher diabetic population who have other comorbid conditions like cardiovascular problems, their nephrological problems, the underlying chronic lung disease, COPD, asthma, these patients have had to face the major brunt of the disease, both in terms of having a longer recovery period, and most of them unfortunately landed up in having intubated and getting on ventilatory support, and as such the extreme mortality rate. But on the counter, the vast majority of the diabetic population who are young, active and have their diabetic blood sugars under control, there seems to be not a problem in acquiring the disease. But let me be very pertinent in telling you that diabetes is a chronic disease, and any uncontrolled blood sugar will actually cause the person to become immunocompromised, and it weakens the person's defense mechanism, the first line of immune mechanism, and hence the person becomes very susceptible to all kinds of infections including COVID. The second question that we usually face is, what are the preventions the diabetic population should take place in these COVID times? Well, my dear friends, the golden rule is to adopt social distancing and not to venture out unless it is necessary. The main aim is to wash your hands with soap and water for 20 seconds or use hand sanitizer which is containing 70% of alcohol. And make sure not to invariably touch your mouth, your nose, your eyes, because these are the entry points. Basic entry points of the virus. We should also make sure that we have adequate supplies of medicines and insulin, people who are type 1 diabetes, so that even if the number of the cases will go up, there cannot be any shortage or in the supply chain disruption. Also, we have seen and we have discussed that a lot of our friends and community members have adult diabetic patients at home, many of whom fall under the age of 65 to 70 years of the age. Let me tell you, this is the most vulnerable class of the people. Therefore, as family members, we should take extra care of them, not only in getting their medicine sorted out, but also help them in this COVID times to procure essential supplies and medicines so that they stay safe and healthy. The third question that we are being asked is, doctor, whether to change any medications in the wake of the pandemic and whether to take any extra immune supplements. Well, my dear friends, it all depends upon your HbA1c control. If your HbA1c control is between 6.2 and 7%, then probably you don't need to worry and change your medications. But if it is down the lane, 7 and above, then you probably need to get in touch with your physicians and healthcare consultants so that they will augment the treatment. In case you're on medicines, they'll probably start a new medication. And if you're on insulin, they'll probably increase the dose of insulin or else switch to a different kind of insulin. At the end of the day, it's better to control your HbA1c and stay safe so that it keeps your immune system tight and kicking. The number 2 question is whether to take any health supplements. Well, I reckon it's very important, especially because the diabetic patient population, their immune system is very weak and fragile. Therefore, it's recommended even by the CDC to give them vitamin D supplements, vitamin C and zinc during these COVID times. And it also helps to a faster recovery in COVID patients. Number 4 question is, should I be doing home glucose monitoring during these COVID times? Well, the answer is yes. In order to make sure that the blood sugar is well controlled, you should definitely do some frequent home glucose 1 touch glucometer home glucose monitoring. And make sure your diabetes is under control, because a good diabetes will not only prevent micro and macrovascular complications, it will also fortify your immune system to make the diseases stay at bay. Therefore, you should try to aim to keep the fasting blood sugar in the bracket of 80 to 130 mg deciliter, and the postprandial or the 2 hours after meal blood sugar in the levels of 140 to 180 mg deciliter. Plus minus 5 is not an issue. But make sure diabetes is about discipline. So take your insulin on medications on time. Number 5. What are the first aid medications that we can take easily and safely at home? My dear friends and viewers, in the wake of fever or any temperature that you feel at home, it's not necessary that it can be a COVID unless you are in contact with a positive case, unless you have come from a pandemic country, or unless you have a pre-positive travel history, or son of your family member is actually turned out to be a COVID positive. It can be just a normal fever, a seasonal flu. So the best and the safe medicine in this regard in these times is paracetamol, Panadol. Make sure you take 500 mg 2 tablets, that's the adult dose, 6 hours a day until your fever subsides. You can always take any antihistamine if you have a running nose to take care of the symptoms, but make sure you should not take ibuprofen or diclofenac and other NSAIDs, because they can exacerbate any underlying kidney disease or cardiac conditions. Also, a proper rest, healthy sleep and good water hydration should make you faster in recovery. The next question is, doctor, what are the red flag symptoms and when should we head to an emergency? My dear friends, if unfortunately you develop COVID or COVID-like symptoms like high-grade fever, running nose, soreness of throat and shortness of breath, and even sudden loss of smell and unexplained loose motions, you should definitely try to check your vitals, try to check your pulse, your blood pressure, and double check your blood sugars. If your blood sugars go crazy, up high, that means you probably are having an underlying systemic infection, maybe an underlying respiratory tract infection and pneumonia. And if your blood sugars land up to be very high, it can be very well a case of diabetic ketoacidosis. In that case, in that scenario, the alarms bell should be ringing and you should be heading straight away to the emergency. One again catch is that you should always use your pulse oximeter to take a check on your saturation. And if it happens that your pulse oxygen shows that your oxygen saturation is running down low, basically anything below 90 is not safe at room temperature. So that should again ring a bell and you should hit the brakes and steadily go to the emergency. Take care, the proper physicians will definitely evaluate your conditions and you will be in safe hands. The other question that's being asked quite commonly, doctor, what are the diets that we can take during these COVID times? My dear friends, as a rule, diabetic patients should take a well-balanced and a well-nutritious diet. 50% of the diet should be carbohydrates, but make sure they're not simple carbohydrates. Instead of rice, you can have brown rice. Instead of white bread, you can have brown bread. You can have cereals. Instead of corn flakes in the morning, just try to have oats in the morning. So cut down your direct carbohydrate intake. It should not exceed 50% of your daily requirement. The other 50% should be replenished with high-grade proteins, lean proteins like egg, meat, chicken, fish, even pulses and beans for vegetarians. Again, you should consume a lot of high-fiber diet and high-fiber multi-grains plus vegetables and fruits to keep you getting all the nutrients that you need during this essential COVID recovery time. Again, let me be pertinent to try and avoid spicy and oily foods because they can disturb your GI system and cause more gastroirritation and probably cause other underlying problems. Again, I would like to emphasize, please don't take fizzy drinks, colas, sodas. They contain a lot of sugar, and even Diet Pepsi, Diet Cola, I'm not a big fan of them because the artificial sweeteners have the long list of their own side effects. So stay safe, eat healthy, have lots of water, have lots of hydration. Hydration once again is an important point to mention because once you stay hydrated, you give your body an extra boost of defense mechanism and your waste material is shed off and extra water and hydration will definitely help you to stay fit and healthy. The other interesting question that we get, the doctor, I'm scared to go outside. What are the exercises or physical activity that I can safely do at home? My dear friends, exercise is very important and part and parcel of the holistic package of diabetic control, because exercise makes your cells more sensitive to insulin and better blood sugar control can be attained by regular healthy exercise. In fact, CDC and AD, American Diabetic Association, recommends 150 minutes of aerobic mild intensity exercise per week. That is around 30 to 40 minutes or 45 minutes per day. So once you're staying inside because of the obvious COVID reasons, make sure you have a treadmill with you. You can do in splits 20 minutes in the morning easily, 20 minutes in the afternoon easily, or else if you have a stationary bicycle for that matter with a good recliner seat so that you sit back and relax, just do 15 to 20 minutes in the morning and then in the evening of varied intensity. If you don't have these two, don't panic. You can just stretch out, you can relax yourself, you can flex your muscles, you can do some push-ups, abdominal crunches, sit-ups. And if not, you can even do your yoga. Most of the people find yoga to be more fruitful and beneficial for maintaining their physical activities. If it's not your cup of tea, then I will suggest the simplest form is just stroll around after every 20 minutes. Just go and walk in your corridor, in your home, in your apartment, 10 to 15 minutes, flex those muscles and try to keep yourself active, and make sure you're not sitting at one place for more than 2 hours specifically, because it increases the chances of deep vein thrombosis, DVT, and other strokes and other problems, because especially if you get COVID, it's a blood coagulation disease as well. So you need to be staying kicking and active. And again, one more thing for the type 1 diabetes, before they ensue any physical activity, make sure to check your wanted blood glucose sugar, and if it happens to be less than 100, then take a snack and take a small bit of fruit to keep your blood sugar slightly higher levels so that it avoids getting into hypoglycemia. Again, one most easy exercise is if you have access to staircase or something in your building or apartment, just do 2 staircases up and down during the day, in the morning, during the night. Obviously, if the elderly are osteoarthritic patient and they cannot manage their balance, it's not for them. But I recommend moving and staying active is the best course of exercise during this pandemic time. It will keep you in a good frame of mind. The next interesting question is, doctor, are there any vaccinations with the diabetic patients can take during this COVID times? Well, I will say we are eagerly waiting for the COVID-19 vaccine, but apart from that, a diabetic patient should always take their annual flu shot and influenza vaccine to make sure that they are at least safe from the seasonal influenza. Basically, in the northern hemisphere, the influenza season starts from October, mid-October, and runs all the way till March. So you should get at least this year's flu shot for sure. Again, people and diabetic elderly population who are actually more than 65 years old and preferably who are ex-smokers or current smokers should actually get their pneumococcal polysaccharide vaccine done for giving them an extra boost of immunity against common pneumonia causing agents. At least they will stay safe. Even if they get COVID, at least they will not end up in getting pneumonias and life-threatening complications. Okay, the last question is what to do to keep our mental status and our mental health in check under the COVID crisis. My dear friends, mental health was always important and it is of paramount importance in this COVID crisis. Actually, there's a saying that a healthy mind has a healthy body. Don't panic, even if you get COVID, don't panic. That is probably the last thing you should do. Just relax, be positive. Shun away all the negativity. Don't watch the negativity on the TV channels and the news of the numbers going up and high. Rather, invest your time in reading a good book, a good novel. Try to catch an old movie. Try to listen to some good music. If not, try to call your families and relatives overseas to get the moral support you will be needing during these times of stress. Again, you can just watch a series, a comedy series to cheer you up. And besides everything, do prayers and meditation. That will for sure give you the inner strength of your soul and give you the ability to fight out this disease like fighters. Last but not the least, stay healthy, stay blessed, stay safe, and be responsible. Thank you so much. Thank you for watching and stay connected.